Welcome back to the program. It is still the Gambia today, coming to you live from our Mile 7 studios here in Banjul. We apologize for that break in transmission due to some power failure over there, but we still have Dr. Emma live on the line. Doctor, good afternoon again. Welcome to the Gambia today.
Good afternoon.
Now, as we were talking initially, I was asking what exactly do you envisage to achieve at the end of the day with regards to your sensitization program in trying to address malaria problems in the Gambia and, of course, in sub-Saharan Africa?
Yes, thank you very much. As you know, malaria is a deadly disease, and in the Gambia, it's no exception. And especially for pregnant women and children under 5 years old, they're the most vulnerable towards malaria. In children under 5 years old, the fever can cause dehydration, and that's very dangerous for children. And of course, the pregnant women, they can risk up to abortion and anemia, which is also dangerous for them. So that's why they're given the Fansida when they go to their clinics to control their pregnancy. So we use Rotarians Against Malaria under the Rotary Malaria Committee of the Gambia, and we saw it necessary to do a malaria sensitization campaign in the hospitals and health centers, especially around the Greater Banjul area this time around, so that we can sensitize pregnant women and mothers of children under 5 years old the importance of malaria prevention and let them know the dangers of it, and of course encourage them to use the bed nets and show them how to use the bed nets and the importance of the bed nets. We also show them we also tell them about the importance of taking the Fansida, especially for the pregnant women. And then also for the mothers, we teach them the different malaria symptoms so that whenever they see these in their children, they can rush them straight away to the hospital without wasting time. So basically that's what we've been doing. We started 2 years ago. We've done we did Sukuta Health Center, New Joshua Health Center, and Fatikunda Health Center. And because of the COVID, we had to pause for a while. And now we've started again, and we've done Canifing Hospital. Now we're at Bundung Maternal and Child Health Hospital, where we've been carrying on this malaria sensitization program for the past month now. And it's important and timely because the National Bed Distribution campaign is going to start this coming month, which will be conducted by the government and the National Malaria Control Program with its partners. So this sensitization program is timely because the bed nets, as we see, sometimes if they're not used properly, it can be dangerous because we've seen people use them as garden fences and use them to cook kere and couscous. So we have to tell them all about the dangers of this and help them to put the bed nets in good use, and also teach them about how to keep the environment clean. And rainy season is coming, and that's when peak malaria season starts. So these are all important preventive measures that we're trying to put forward so that the population can be aware of it.
Now, Doctor, as you have highlighted, we understand that all you are doing is complementing the government's effort in the fight against malaria. But what messages do you put across to your targeted population, especially in your drive to sensitize the community?
Yes, basically, like I was saying, for the pregnant women, it's important for them to take the Fansida. When they come to the clinic, they have to take the Fansida there during their pregnancy control. Some of them don't like to take it, they complain about it, some of them have fear that it will do something to their children. So we're trying to enlighten them to let them know that it's a safe medication to take. And also when we go to these different health centers, we go with a representative of National Malaria Control Program, representative of the Regional Health Directorate, and the midwives and nurses and public health officers are all there. So all of us together give out these malaria prevention messages to the pregnant women and the mothers of the children under 5 years old. And for the children under 5 years old, it's important that their mothers know how deadly malaria can be for these children. So we encourage them to sleep under the bed nets. We encourage them to take their children to the hospital as soon as they see malaria symptoms in them. So basically that's what we'll be doing. And not only for pregnant women and children under 5, we're also supporting the bed net distribution campaign, where we're sponsoring radio programs which will be spread all across the country, especially radio spots, which will give instructions of how the bed net distribution campaign is going to take place, which will be run by the government, and also different malaria prevention measures that will be taking place. We've also sponsored donated two fogging machines which are used for outdoor insecticide spraying of mosquitoes, and we've done an exercise in Banjo last year by October, and where we did that, the whole of Banjo was sprayed. So those are the different measures that we've been taking to support government in trying to control malaria. 2 years ago, we also...
Now, Doctor, you have mentioned about bed nets, but in the Gambia over the past few years, we have seen these bed nets being used for the wrong purposes. What exactly have changed in your approach this year, especially towards the distribution of these bed nets? Well, we have lost Dr. Emma Bruce on the line over there. Our technicians are keenly working on it to restore the connection, as we have been speaking to Dr. Emma on the malaria prevention and sensitization program, and that actually right now they are targeting children under 5 and pregnant women. And of course they have been going around hospitals in the country looking at the Bundung maternal and child health hospital, and of course Joswang and Sukuda. Over the years they have been going around and then trying to sensitize these vulnerable groups of the population, especially as we move towards the rainy season when the malaria disease becomes prevalent in this country. We'll take a short break. When we come back, the program continues. Stay tuned.